Most who have suffered with headaches and migraines have, through their frustration, learned that migraines and headaches are among the most aggravating conditions to treat via traditional medical options. The frustration over their prevalence is in part due to a lack of understanding as to what causes them. Years ago, Dr. Seymour Diamond, the head of the National Headache Research Foundation at the time, identified what he believed to be the cause: a malfunction in the nervous system's hub, the brainstem. Through advanced imaging, he mapped neurological activity in the brain and the brainstem before, during, and after attacks. Before a trigger was introduced, the brainstem was overactive. When the trigger was introduced, spikes occurred across the board, consistent in the brainstem as before, and also in various parts of the brain. Imitrex was introduced via injection, and turmoil reduced in the brain as the symptoms began to subside. But the brainstem remained overactive. After follow-up studies, Dr. Diamond concluded that drugs to suppress the symptoms of migraines and headaches don't affect the brainstem. The brainstem remaining overactive was the reason, in his opinion, that the symptoms kept coming back, were so prone to return. It begged the question, if the brainstem malfunctioning was the cause, what causes the brainstem to malfunction? And then what can be done about it? The brainstem is located where the head converges with the neck, and a misalignment there affects brainstem function. The brainstem is the control center of the human body. It regulates pain and breathing and heart rate. It controls balance and blood pressure and digestion. It controls the expanding and contracting of blood vessels too. So when it malfunctions, the brainstem provokes a crisis in the body, and it prompts the blood vessels around the brain to swell, laying the foundation for the triggers to set off the attacks. Fortunately, these misalignments can be precisely identified and safely corrected by an upper cervical practitioner. We use specific diagnostic imaging to discover the complexities of the problem, and then set the vertebrae back into their proper positions, removing the irritation to the brainstem and restoring proper blood flow to and from the brain in order to decrease and often eliminate perhaps the principal cause of headaches and migraines.